Why should you be concerned about Medicare? The most common cause of bankruptcy are medical bills. And so as you go into retirement, as you turn on your Social Security, your pension starts coming to you, you want to spend time with grandkids, hobbies, that sort of thing, the last thing you want to be concerned about is whether you can pay your medical bills. And so that's why you want to understand Medicare and put things in position to protect you so during those golden years, during your time of retirement, you don't have to be worried about medical bills. Medicare is divided into two parts, Medicare Part A and Medicare Part B. A has everything to do with the hospital. A doesn't cost you anything because you paid for it during your working years. So those payroll taxes they took out for federal, state, Social Security, Medicare was one of those lines. And so Medicare Part A has everything to do with the hospital. So you go to the hospital, first you have to pay a deductible. People don't realize this, but the deductible currently is $1,288. Now that is per benefit period, and a benefit period is 60 days. Now what does that mean? Go to the hospital, assume you have nothing else, no supplement advantage plan, you just have original Medicare, Medicare A and B, you pay the first $1,288. Then after that, everything's covered 100% for 60 days. Let's say you leave the hospital again and you go home, you're convalescing, there's a complication. You go back to the hospital. Since it's within 60 days, you don't pay a new deductible. But if you went back 61 days later, you would pay the new $1,288. Let's say you left the hospital again within maybe 20 days of that last event. You get in a car accident, you go back to the hospital. Even though it's within 60 days of that first event, it's a new event, so you pay a new deductible. Consequently, you could pay that deductible, that $1,288, multiple times in the course of the year. Sometimes people don't realize that, but that is Medicare Part A. What is Medicare Part B? B has everything to do with stuff other than the hospital. It's your doctor's visit, your outpatient procedures, all that kind of stuff. So that means blood work, x-rays done outside of the hospital, you're not admitted to the hospital, emergency room, those kinds of things. And so Medicare Part B does cost you something. It's currently, for people just going on Medicare, not on Social Security, $121.80 per month. People that are already on are probably paying $104.90. Again, it depends upon your income. But again, currently $121.80. Now, for those things I just mentioned under B, doctor and outpatient stuff, Medicare pays 80% of the cost. You're on for 20%. But the key thing about that 20% coinsurance that you pay is that there is no cap on that. There's no maximum out of pocket. There's no limit. So in other words, as the bills roll in, the money rolls out. If you have $1 million worth of bills, to give it a number, under Part B, you owe 20% on that, which would be $200,000. So just to help you understand, with Medicare Part B, there is no limit on the coinsurance that you pay. So what is Medicare? Again, a federal program, and it comes to you in two parts, Medicare Part A, Part B. A for the hospital, B for doctor and outpatient. You need to understand those two building blocks before we can add in terms of Part D, Part C, supplements. That is the basis of Medicare and what it is. That's how you're going to protect yourself when you go into your retirement. Thanks for listening. This is Chris Grimman at Omaha Insurance Solutions. I invite you to like this video. If it was valuable to you, share it with friends and relatives. And please visit our website, OmahaInsuranceSolutions.com. Give us a call at 402-614-3389. We can answer questions in terms of Medicare, your Medicare plan, your supplement, your Part D. We would love to help you.